Let's say this. First understand the term what are medicines and drugs. Okay. So these are those chemical substances which are used for treatment of diseases and to reduce any pain. Okay. These are called as medicines or drugs. Got it? And mainly you got to understand targeted based drugs. Okay. Now usually any biological catalyst are called as enzymes, isn't it? And these are naturally proteins. And these are going to act as a critical communication system in our body, and these are called as receptors. Got it? Now, which carry polar molecules across the membranes. These are called as the carrier proteins. This is a basic term you should know. Next, mainly when it comes to targeted drug, check how exactly it works. First, an enzyme will always have something called an active site. And on an active site, the drug which we are sending, which will act like a substrate, that substrate will bind onto the active site. Okay? And once it bind onto the active site, that's when it will start showing its functioning. Okay. So you would know that you can see it here. Mainly when it comes to interactions within the enzyme, the interactions could be either hydrogen bonding, or dipole-dipole interactions, Van der Waals interactions, or even ionic bonding. Okay, and they'll hold tight enough, but also weak enough to allow products to depart after their formation. Okay, so from this substrate, as it forms products, correct, it can depart out of that particular site. Okay, now notice the main function of the enzyme uh, is to attack the substrate to carry out the chemical reaction. And see, the function is to carry out some of the amino acid residue of protein present on the active site of the enzyme. These provide free amino groups to attack the substrate and bring about chemical reaction. And if amino acids like serine is present nearby the substrate held on active site, then its OH group is free to act like the nucleophile in the enzyme catalyzed reaction. Okay. So usually what are all the functional groups which you notice on the enzyme which can attack on the substrate? Please learn this part. Okay. It could be SH of cysteine, COOH of aspartic acid, phenyl ring of the L-phenyl alanine, and heterocyclic ring of histidine. Okay. These are typically the sites which can attack on the substrate and cause a nucleophilic reactions. Okay. Now, how does the interaction work here? Drug which interact with any two active activities of the enzymes are called enzyme inhibitors. Okay. Enzyme inhibitors can block the binding site, thereby preventing the binding of the substrate. Okay. Or drugs which compete with natural substrate of their attachment or active sites of the enzymes are called competitive inhibitors. Okay. So you can see two types of drugs. Correct. One drug will try to compete with the uh, uh, natural substrate, correct, and try to take this active site onto it. Okay. See, the other one will try to block the site completely from substrate to come onto it. Got it? Clear? So these are competitive inhibitors. Now, notice In certain cases, instead of going and sitting on the active site, the drugs will choose something called allosteric sites. Okay. And once they go to the allosteric site, the drug will sit and change the shape of the active site. And hence, any substrate that want to sit here, earlier it might be easy. Now the entire shape has changed. So this will not cause any attack of substrate at that location. Okay. So this terminology was asked before. So learn that what is allosteric sites. Got it? So this binding of drug at allosteric site changes the shape of active sites of the enzyme. Okay. Now such type of drugs are called non-competitive inhibitors. These are non-competitive inhibitors. Okay. Now typically how the system works here, whenever there is a receptors present to communicate the messages between the cells and to the nerve cells. How does it work? Check out. For a communication system, receptors are proteins which are crucial. Majority of the receptors are embedded in the cell membranes in such a way that their small part possessing the active site projects out of the surface of the membrane and opens the outside region of the cell membrane. Okay, especially this happens on the walls of the cell. Okay, this is the walls of the cell, and that is where you will see this kind of communication happens. Okay, let's say this is the interior part of the cell and this is the outer or exterior part of the cell. Okay, and to communicate there will be this kind of enzyme present on which a binding site can cause a communication towards inner cell, and the same can cause outward towards the nerves. Okay, this is typically how the communication system works. Okay, now the particles or substrates which will bind here to make a communication between, I mean, inside and outside the cell, those are called as receptors. Okay, clear, everyone? Check. When it comes to receptor proteins, it changes a little for accommodation of these chemical messengers, and it gives a message to the cell without even entering the cell. After the transfer of message, the chemical messenger departs and the active site of the receptor protein returns to its original shape. Okay. This is usually how the targeted drugs work. Okay, they will specifically go on to that wall of the cell and combines on it, got it, and provides the communication of the message, and from there it will come out. Next, check
What
out
type
type of
of
messengers. First,
first
hormones,
hormone, neurotransmitter.
neurotransmitters. Right. Check out hormones. See, hormones are the group of biomolecules which are generated in ductless glands. Okay, these enters the bloodstream. These enters the bloodstream and travel to different parts of the body, activating all the receptors which recognize them for the message transfer. They are not deactivated very quickly. Okay, now this is important. They are not deactivated quickly. Adrenaline is an example of an hormone. It is released from an adrenaline medulla in situations of stress or danger. It prepares the body for physical exercise to bear the stress. Okay, this is one of the important drug which I'm sure you know that. Next, neurotransmitter. Now transmitters messages through through the neurotransmitters. These are small molecules such as these are small molecules such as acetylcholine. right? And dopamine and serotonin, these are the ones which are neurotransmitters. Okay. These bind onto the receptor of a very short time to transfer the message, and after transferring the message, departs unchanged quickly. Then the message inside the cell is forwarded to the receptor. After leaving the active site of the receptor, neurotransmitters undergo degradation and lose their capability to transfer the message. In other words, unlike hormones, they are quickly deactivated. The degradation processes of neurotransmitters go back to the nerves, ending to form the active message again, and thus the cycle of message transfer can be repeated again. Got it? So this transfer of message will be only temporary, just for that instant messages which has been transferred between cells in inner cell and the nerves. Typically, how the chemotherapy works, check out. Chemicals within the chemotherapy are frequently classified on the basis of their action. Okay. Now, analgesics release the pain, antipyretics reduce the body temperature. Okay. And anti-inflammatories control the inflammation, and antibiotics kill the bacteria and other microorganisms. Okay. So these are the typical definitions you should know. What is analgesics, antipyretic, anti-inflammatories, and antibiotics. Okay. Now, chemotherapy is a word used as a type of treatment for cancer that used one or more than anti-cancer drugs as a part of the standardized chemotherapy regime. Okay. And see, antipyretics are substances used to bring down the fever. Okay. Uh, Best examples: aspirin, phenacetin, and paracetamol analgesic. Okay. These are the antipyretics. See, I'm sure you know the chemical formula for aspirin. Okay. It is acetyl salicylic acid. Is acetyl salicylic acid. Okay. It may cause the ulcerate in the stomach and causing bleeding by producing salicylic acid when taken in empty stomach. Sodium and calcium salt of aspirin are more soluble and are less harmful. Paracetamol. It is it is 4-acetamide phenol. It is a better antipyretic than aspirin. Okay, so this is that structure, everybody. So please do remember paracetamol structure. Okay, next phenacetin, 4-ethyl acetanilide, right? So this is the phenacetin. This is less likely to be asked as per your syllabus. Paracetamol is the one which you need to learn. Aspirin is the one which you need to learn. Okay, next, check out analgesics. Analgesics are the drugs used for relieving the pain. Okay, along with aspirin, phenylbutazone, uh, butazolidine, and some other antipyretic are known ones. Okay, some narcotic drugs which can be used in analgesics form morphine, marijuana, codeine, okay, pethidine, and heroin. Got it? So the other day, I'm sure we came across this question. So please check how does the structure of morphine looks like. Okay, if R is H, then the product formed is morphine. Okay, betadine hydrochloride. If R is CH3, then the product form is codeine. Got it? And if R is OAC and OAC on both ends here and here, then that is heroin. Okay. Along with that, ibuprofen, uh, ibuprofen and dichlorphenac, sodium naproxen are also used as the analgesic. Now, this is naproxen, which is also very commonly used, as the analgesic. The structure of ibuprofen is something which you should learn. So check it out. This one. So it is like the benzoic acid part, which will have CH2 here and this way. What is this one? 1, 2, 3, 4. Isobutyl para-isobutyl benzoic acid. Diclofenac sodium. This is diclofenac sodium part. Again, this is rarely asked. Mainly, you should emphasize on the structures of heroin, uh, codeine, and morphine. Along with that, learn ibuprofen. Next, what are antibiotics? Antibiotics are chemical substances produced by microorganisms such as fungi, bacteria, and molds. They can inhibit the growth or even destroy the other microorganisms. Okay. Now, these are two kinds here. One is broad spectrum antibiotics are the medicines effective against several different types of harmful microorganisms. It is more generic. Any antibiotic which is more generic, that is called broad spectrum, like tetracycline, chloramphenicol. Narrow spectrum, on the other hand, antibiotics which are effectively mainly against gram positive or gram negative bacteria. Okay. Whereas the antibiotic which are effective only against a single organism or disease, these are called limited spectrum antibiotics. Okay. Gram positive or gram negative, which means we will have some growth based bacteria, okay, or microorganisms, correct? So those gram positive, it means it does not cause much harmful in the gut bacteria, or it does not cause much harmful in the intestinal segments. But gram negative is one, the growth could also cause uh, harmful disease. I mean, it will give some harmful signals to our body as well. Got it? So if you're targeting only to these drugs, correct? So that is narrow spectrum. And if it is about a single organism, that is called as the limited spectrum antibiotics. Okay. Now notice penicillin has a narrow spectrum. Okay. Ampicillin and amoxicillin are derivatives of the penicillin themselves. Penicillin and cefoxiparin or beta lactam are the antibiotics as well. Got it? Out of this, if you ask me, penicillin is something which you should learn thoroughly. How the structure of penicillin would be. It will be mainly acting on the narrow spectrum, and it will be checking mostly on the gram positive type of bacteria. Got it? These are the words you should look out for. Now check this out. What is penicillin? Alexander Fleming, I'm sure you know all of this. Okay. So this is used against a large number of infections causing various bacteria. It is an effective drug for sore throat, pneumonia, abscesses, and bronchitis. Antibiotics like streptomycin and tetracycline are used against the diseases caused by bacteria. Some antibiotic diseases, specifically, for example, streptomycin for tuberculosis, for TB, and chloramphenicol for typhoid. Okay, very important words. Please remember that. Which is used for what? Correct. This is for penicillin. Okay. Now, please notice the structure of penicillin carefully. There are various types of questions that have been asked. How many number of chiral centers penicillin possess? This is one chiral center. This is one chiral center. This is one chiral center. Correct. And nitrogen is also a chiral center in this case, isn't it? If the number of chiral centers are asked, your answer should be four of them. These four are the chiral centers. Correct. Now you might ask, sir, what about this one? Isn't the lone pair going to make uh, any resonance stabilization here? Got it? Right? Very small amount of resonance has been noticed because it is almost like a bridge position here. Got it? So if they were asked about the active sites, then these are the three active sites on which you might see some optical activity observed. Okay? And see, if the R group here is benzyl, it is called the penicillin G or benzyl penicillin. If R type is PC, I mean benzyl OCH3 minus, Okay, methoxybenzyl group. Then this is penicillin V or phenoxymethyl penicillin. Okay, next. Ofloxacin. Ofloxacin is another chemical which is used for same broad spectrum. Now, notice this one, chloramphenicol. This is very important. This is one very repetitive case which is asked. Check out. Chloramphenicol is a broad spectrum antibiotic. It is rapidly absorbed from gastrointestinal tract and hence can be used orally. It is in case of acute fever, typhoid, forms of urinary infections, dysentery, okay, meningitis, and pneumonia. Okay, so this is the structure of chloramphenicol. Chloramphenicol. Okay, very important structure. Sometimes it has been asked how much is the composition of nitrogen, how much is the composition of chlorine, how many oxygens are present in chloramphenicol. These are all the detailing. So please learn the structure thoroughly. Next type of drug is tranquilizers. Tranquilizers mainly act on the central nervous system. Okay, their main role is to calm or give a soothing effect due to the relief of tension or anxiety. Okay, there are two types of it. One is sedative or hypnotic. The other one is mood elevators or antidepressants. Sedatives. Sedatives are central nervous system depressants that reduces the nervous tension, okay, and promote relaxation without indulging into the sleep. For example, diazepam, okay, are composed. You know, this is how the in for in medical stores will be usually used as compose. Okay, meprobate, that is also known as the equanil, okay, equanil and serotonin. These are the main sedatives, correct, which are hypnotic. Okay, check out Valium or diazepam. This is the one, and serotonin. This is the structure of serotonin. Correct. If you ask me what is more important in this is this one, barbituric acid and equanil. Where is the equanil? Here, equanil. Okay. This is the one which is more likely to be asked. So learn that thoroughly. Notice. See, what does hypnotic drugs do? Right? They will induce the sleep. Got it? They'll always induce the sleep and act like the antidepressants. Synthetic compounds used as sedative and hypnotic is barbituric acid and its derivatives such as lumicol and seconal and equinol. Okay, these are all acid based. These are all acid cases known as barbituric acids. Correct. So in barbituric acid, one thing you should understand: these are all amides, cyclic amides. Okay, but they will have this active methylene kind of a case, and then we have this NH. You can see that, right? These hydrogens are sufficiently acidic. So that's why it is called barbituric acid. Same goes with lumanil and equanil. Clear? This is the equanil. Some known hypnotic tranquilizers are chlorodiazoxide and mepromdate, but these are not something which are very much useful for exam point of view. Don't worry about it. Now coming to the antidepressants. These are the drugs used for treatment of highly depressed parents, patients. These are known as the mood elevators. Got it? Now, if it comes to Nordil, okay, Nordil, phenelzyme, which is the name, you can see it will have NH2, connected on the phenyl with ethyl group on it. Next, one second, where is it? Yeah. Nodil is the one which is used the most when it comes to antidepressants. So please learn this part of it. Okay? Others are not usually there for your syllabus. Check. Next one is antiseptic and disinfectants. Antiseptics are those chemicals which kill or prevent the growth of microorganisms. Okay? For example, Salol, Dettol, okay, Acryflavine, Catavolol, potassium permanganate, etc. These are all antiseptics. Okay. Dettol is a mixture of terpineol and chloroxynyl. Okay, this is the most famous antiseptic. You can see this is chloride, chloroxylenol, and this is terpineol. Got it? Both have been asked in exams in multiple times, so please learn it. How the Dettol combination is formed. Salol, I'm sure you know that phenyl salicylate, okay, is an intestinal antiseptic. Act, aqueous solution of the boric acid is a mild antiseptic for eyes. Mild antiseptic for eyes here. Next, bithionol is used in soaps to reduce the bacterial odor on the skin. Okay. Bithionol is also been asked, like number of chlorines present in it. Okay. So learn that. Antiseptics are applied to the living tissues and can be applied to the wounds, cuts, ulcers, and diseases on skin surfaces. Okay. For drinking purposes, chlorine is used to make the water fit. Low concentration of sulfur dioxide is used for sterilizing, squashing for prevention. Iodine is a powerful antiseptic. It is employed as the tincture of iodine. Iodoform is used as an antiseptic wound powder. Next, this we just discussed already. So, disinfectant kills microorganisms. However, they are not safe for contact with living tissues. Okay, so they are mainly used on floor, instruments, etc. Okay, solutions of Cresol, soap water, Lysol. Okay, so these are all disinfectants. Okay, now by varying the concentration of the solution, some substances act like both disinfectant and antiseptic. So you can see 1% phenol acts as disinfectant while 0.2% solution act as antiseptic. Here, everybody, important point, learn that. Antiviral drugs are not usually asked, but after COVID, this has been introduced. Check out. The most common antiviral drug is AZT. Okay, 3-azido 3-deoxythymine, which is used in AIDS. Next, anti-fertility drugs or oral contraceptives. These are checked for pregnancy in women. They control the female menstrual cycle and ovulation. For example, uh, Enovid E. It is mixture of norethindrone and mestranol. Such drugs are normally combination of synthetic estrogen and estrogen derivatives. Okay. The most common estrogens are this line is important, everyone. Estrogens are novestrol or uh, ethinylestrol and estrogen derivatives are norethindrone. These two lines, everybody. Okay, estrogen and progesterone, or these two are the derivatives which are mainly checked for pregnancies. Correct. So that can be controlled using novestrol and norethindrone. These are their structures. This is once asked in an exam. So Novestrol structure, please check it out. Next, anti-allergic drugs or antihistamines. Okay, these are the ones which cause the cause of allergy as allergic reactions due to the liberation of histamine in the body. Liberation of histamine in the body. Okay, and the drugs which we use are called as antihistamines. Right from the any skin uh, pigmentation or sneezing, correct? any irritation in the body. Those are all because of histamines. And to stop that, we use antihistamines. So basically, these drugs interfere with the natural action of the histamine by competing with histamine for binding sites or receptors. Okay, these are quite effective in the case of uh, rhinitis, nausea in pregnancy, fever, etc. Okay, yeah, this is the most used drug. Uh, both for, even if you see pediatric drug or as an adults, we'll always see chlorophenamine. This is the one which is used in that, what do you say, that nose drops. Okay, Otrivin, sure you're aware. Okay, along with that, bromopheramine. These two are the drugs which are most used. Next, antacids. These are used to remove the acidity of stomach. Okay, magnesium hydroxide or magnesium carbonate, magnesium trisilicate, aluminum hydroxide. These are the ones which are used. Okay, omeprazole and lansoprazole. These are used as the these are most commonly used antacids. Okay, metal hydroxides are better as they increase the pH only up to 7. Okay, Zantac is another very important discovery which was used, and in India it is one of the most producing drugs. Sorry. Yeah. Antacids mainly work on counteracting or neutralizing any excess amount of stomach acid. Stomach acids which are produced, are from stomach lining, which gives HCl, concentrated HCl. Okay. So you can see these drugs not only neutralize HCl, but also prevents its formation to give the relief from hyperacidity. Okay. Anti-malarial and all is not there for you. Check out. Antimicrobial is there. So such drugs cure diseases caused by microbes like bacteria, fungi, virus, etc. Okay. These may be two types. You can see bactericidal, which means you will kill the microorganisms, or bacteriostatic, which means you will keep a check on the growth of the microorganisms. Okay. Salvarsan, which is used for uh, syphilis. This one is the bactericidal. And all sulfur drugs, sulfanilide amide, correct? And prontosil, yeah, prontosil, sulfaminide, and salvarsam. These are all used as the antimicrobial drugs. Okay, read this carefully. Sulfur drugs are antimicrobial as well as, inhibit the growth of bacteria as well. So they have also been found to be active against gram positive as well as gram negative cocci, bacillia, and protozoa. These are the names of the bacteria. Okay. Clear? Next, anesthesia. There are two types of anesthesia: general anesthesia and local anesthesia. They produce General anesthesia produce unconsciousness and given when major surgical operations are to be performed. Okay. Some of the common liquids that are given is nitrous oxide, cyclopropane, ethylene, etc. Local anesthesia. They produce loss of sensation on certain part or portion of the body, right? So examples are xylocaine, ethyl chloride, or procaine. Got it? These are the local anesthesias used. Correct? Mostly procaine is the one which is commonly used by doctors. Okay. Next. Chemical foods are of I mean, of course, all the chemicals which are used in the foods, these are called as additives. Okay. Now, in this we have many types. One additive is a preservative. Okay. Preservative are used to protect the food against the infection of bacteria, molds, yeast, and other fungal infections. Okay. Sodium benzoate is the most commonly used preservative, right? And which metabolize into hippuric acid. Got it? This will metabolize into hippuric acid, which is secreted in urine. Next, potassium and sodium meta bisulfate. This is used in the pickles, gems, and etc. Okay. Some salts of sorbic acid and propanoic acid, okay, or phenoxide benzoate esters are also used as the preservative. Next, coloring agents. Some dyes, natural synthetics are used as the colors to form stuff. However, these must not be harmful. For example, natural edible colors are turmeric, carotene, saffron, caramel, anota, etc. These are all natural colorings. Okay. Next, some synthetic edible colors are azodyes, tetragen, TiO2. Okay. See, normally we add whitener, correct, for clothes, which are azodyes, correct, and TiO2. Next, sweetening agents. Okay. Sweetening agents are low calorie sweeteners, correct, here, and they can easily pass through the human body unmetabolized. Correct. Sucrose, fructose are natural sweeteners. So you can see saccharin, which is sodium or calcium based salt that is used as most common sweetener. It is around 600 times more sweet than the normal sucrose. Okay. It is biodegradable. Cyclamate and sucralase, correct? These are aspartame. These are all some of the other common sweeteners. Okay. These are mainly calorie free, which do not cause tooth decay as such. So you can see saccharin structure is very, very important. Okay. This is part of some chemical reactions also. So learn that. Okay. Aspartame is also an important part because it is part of the biomolecules amino acids. Got it? Allitame. Allitame is also an important part. So these three are the ones. The highest amount of sweetness is by allitame. This causes the highest amount of sweetness. Antioxidants. These are used to prevent oxidation of fat in the foodstuff like biscuits, potato chips, etc. Okay. Okay. Butylated hydroxytoluene (BHT), butylated hydroxyanisole, correct? SO2. This is used as the antioxidants in wine, beers, etc. Okay. Both BHT, BHA check the aging of the food material. Soaps. This part is the most important part out of this topic, so learn thoroughly now. Soaps are sodium and potassium salts of higher fatty acids like stearic acid, palmitic acid, lauric acid, and linoleic acid. Okay. Soaps follow the steps that is they are manufacturing using the method saponification, where you has triglycerides, correct? These are all the triglyceride forms. Reacting with 3 moles of NaOH will give you 3 moles of soap and glycerol. Okay, these are the triglycerides. Triglycerides are the fatty of, I mean, they are stored as the fats, correct? And through that we can get the soaps. Soap are commonly biodegradable, however, they cannot be used with hard water as calcium and magnesium give curdy white precipitate liquid. Okay, and now these insoluble salts are scums. inhibits cleaning action of the soaps by hindrance. Soaps cannot be used in acidic solution as acids precipitate the insoluble RCOOH to reduce the cleaning part. Next, cleansing action of soap. I'm sure you are aware of this. I'm not going into details of that. Okay. Now, notice detergents. Detergents are sodium salts of alkyl hydrogen sulfate. Okay, of or alkyl benzoate sulfate. It's our alcohols. They are not or okay, they are not completely biodegradable, but can be used in hard water. Detergents are of three types. Non-ionic detergents. These are highly molecular mass esters. See, high molecular mass esters of polythene, glycol, and stearic acid. They may also be formed by reaction of ethylene oxide and long chain alcohols, like lauryl alcohols, like this. This lauryl alcohols, and if you have this uh, epoxides here, first they will form this alcoholic forms, then polyethylene glycol when you use, right? And this acid, sorry, with this acid if you use, this is the kind of structure that you will get. Got it? So these are polyethylene glycol stearate, which is non-ionic detergents. Lauryl alcohols, got it? This reacting with base will form lauryl alcohol ethoxylate. These kind of structures, if you observe, these are all going to be non-ionic detergents. Now, what is cationic? These are quaternary ammonium salts like chloride or bromide, etc., having one or more long chains of alkyl groups and having gemicidal properties. For example, okay, cetyl trimethyl ammonium chloride. Okay, so this is a cationic detergent. Got it? Anionic. These are large part of molecules of an anion, and this cause effective in acidic solutions also. These are two types: sodium alkyl sulfates, correct? So you can see the structure here. Okay, N-lauryl alcohol. When you react with concentrated H2SO4, you will get this N-lauryl hydrogen sulfate. Okay, and if you react that with NaOH, you will get sodium lauryl sulfate. Correct. Lauryl sulfate is also a composition of shampoos. Correct. Along with detergent, it is also been used in shampoos. Alkyl benzene sulfonates. The most common domestic detergent used is, SDS, sodium sodium dodecacyl benzene sulfonate, okay, and sodium O2 dodecacyl benzene sulfonate. Okay, just a second. Sorry, please check. This is the structure of SDS, sodium 4 dodecyl benzene sulfonate. Okay, this is important. Learn this. Next, cleansing action of detergents. I mean, this is not that important. It is very similar to that of soaps. See, just although dyes are not specifically there in the NCRT, just read it once. Dyes are chemical components. Dyes are chemical components which have particular colors and are capable of being fixed to the fabric, okay, like wool, paper, leather, etc., permanently. Okay, these are chemically stable and resistant to the action of water, light, and soap. Okay, now first, all colored substances are necessarily dye. This must be fulfilled to be a dye here. It must possess a suitable color. It should be capable of getting fixed on the material from its solution, either directly or with the help of a mordant. Okay, mordant is the uh, liquid which will help it to absorb that. When fixed to fabric, it should remain fast to the exposure of light, resistance to the action of water, dilute acids, and dilute alkali. Then only we call them as dyes. Okay. Next, see, cause of the exhibition of color. When beam of visible light falls on the color substance, some part of the light is observed, some part is reflected. The color that is reflected one is the complementary color which we observe. Okay. According to the chromophore oxophore theory proposed, the color of the dye is due to the presence of certain groups of the molecules. Okay. So please remember this part. Correct. The chromophores which will impart the colors includes nitro, nitroso, azo, and azoxy. Got it? If you have these groups, they will cause colors. Along with that, any quinoid form, that is non-benzenoid form, quinoid or non-benzenoid form, okay, or phthalene group. So if you have this kind of groups only, you will observe the colors in the dyes. Okay. Oxochrome is nitrobenzene is a pale clean compound, but whereas oxochrome OH is present in the ortho or para position to the nitro. This causes deep yellow coloration. Okay, one second. Please note the color here. It is Mauritius yellow. This is deep yellow color. Orange color, we have seen this, orange 2 and alpha naphthol colored. Here, where is one more? Yeah, this one. Beta naphthol, which we have in the syllabus. Okay, beta naphthol color. Now, what are basic dyes? See, the dyes to the dye, nylons and polyesters are to the dye modified. Nylons and polyesters dyes are used. For example, malachite green and aniline yellow. This is aniline yellow. Got it? And is it? Yeah. This is malachite green. These are the ones which are used. Congo red is only used as words, but we do not will not be asked as a structure anywhere. Okay. Next, last thing is about fungicides, herbicides, and insecticides. Mainly go with the names here. So check out here this part: aldin, dialdin, methoxychlor, and DDT. Okay, and BHC, benzene hexachloride. These are some of the non-biodegradable insecticides. Okay, these are non-biodegradable insecticides. Enzymes. Right. Okay. Now let me quickly go through it once. Show you what all pointers you need to mainly remember here. Okay. Check out these examples. I'll mark them one by one. Aniline yellow. Check out the color. beta naphthol, orange one. Yeah, Martesius yellow. Next. Which are the groups which uh, which gives chromophore to the dyes? Check out the domestic detergents. This is the domestic detergent used. Understand every part of detergents that includes anion, cation, and non-ionic. Important reaction of saponification. This table is also there in NCRT. Okay, got it. Mainly notice the colors of saccharin, aspartame, and allitame. Sulfurs, because it will have an arsenic linkage. Okay, that's what is the question asked. Which one has arsenic linkage and which one will have azo linkage? Zantac, this one, bromophenicon and uh, chloramphenicol. Biethanol, very important structure. Nodal, equanyl, barbituric acid, basic barbituric acid, and chloramphenicol, penicillin. Morphine, you know how it is being checked into codeine and heroin. I think recently also we have come across this, so should be able to remember. Paracetamol class. Rest is just a theory part. Just read it out once. Okay, that's it. Okay, so please go through that today itself. Okay, go through it once. I added few questions. I made one sheet on it. So once you're done with it, just go through it.